prior to using wound rounds, the process that we went through for gathering the information to do Section M and the MDS could be quite overwhelming and frustrating. We often had to dig through charts, the treatment records, nurses' notes, trying to gather all that information, sometimes even having to interview staff or tracking down the wound care coordinator to get that information, to get it all together. It could be very frustrating when you don't have all the information you need. Even one little piece is missing. It makes it very difficult to complete that section timely until you can track down that person that has the information. It could be overwhelming, frustrating, time-consuming. It could take as much as an hour sometimes to get all the information gathered to get it entered for a complex wound patient. Now it's a matter of minutes. When I am doing my MDS, I keep wound rounds open in the background, so I'm just flipping back and forth between the two screens. If I do Section M, I have my wound rounds open, I pull it right up, it's entering the name, entering the dates, and it gives it to me in a matter of 2 minutes, and I've got Section M information done, ready to put in. I would never do an MDS without using wound rounds. After having used it, you can't. It takes all the guesswork out of it. I don't have to guess and wonder, is that the most accurate information, the most up-to-date information? Is everything right? Do I have the measurements correctly? Am I using the right measurements or the right dates? It's all right there. I just pull it up, put my dates in. I have everything I need. Very simple. I don't have to guess and track people down to get that information. So, if a patient has many complex wounds, you have to look at all the measurements, the dates, and compare all that information to do Section M. With wound rounds, it's all done for me. I don't have to track down our wound care coordinator who's busy doing her wounds and say, hey, you need to stop and come and help me and figure this out. I don't have to track down nurses. A complex wound patient can have 3, 4, 5, or 6 wounds, and trying to assimilate all that information to get the most accurate data, it can be very complicated. Wound rounds assimilates all that, assesses it, puts the right information in for me, and I just plug it in, pull it out, and we're done. I think wound rounds has greatly improved our accuracy and efficiency. Spending an hour to collect data for a complex wound patient versus a couple of minutes now with the program is a huge savings. Saves my time. It frees me up to spend more time with patients, doing MDSs, other job duties that I might have. Without a doubt, I know that my data is more accurate that I'm entering. I don't have to guess and, to the wound care coordinator, maybe she's got the measurements and she hasn't entered them in the computer yet, or the nurse didn't chart something accurately, what she thought she saw was different than what it is. I know that all the information is right there and it is accurate. I can even look at a picture of the wound if I need to when I'm doing my cause to make sure that, what's here and what's there is what I'm writing. So I don't have to actually go in and see a patient. I don't have to track down anybody. I don't have to dig through a chart. So it's absolutely much more accurate. I think the change from 2.0 to 3.0 in the Section M has been much more complex. They're looking for different information, new information that we weren't having to get before. And instead of having to change my way of gathering that information and trying to figure out how am I getting it, wound rounds does that for me. It took the guesswork out of that transition. And actually, I think it really did help in our transition from 2.0 to 3.0. I didn't have to guess. I just went in, got my information out of wound rounds, and I knew that it was right. Working with the wound nurse and doing Section M and preparing for it, sometimes it's easy if she's right there in the office, but if it's a day that she's out doing a lot of treatments or assessments that day, she may be very busy and going from patient to patient and might not be there. With wound rounds and Section M worksheet, I don't have to track her down to get that information. I don't have to try to pull her away from patient. It frees her up to have her time to care for the patients, and it frees me up to be able to get my work done in a more timely manner. I would never want to go back to the way things were before we started with wound rounds. Wound rounds is probably one of the most amazing programs that I've worked with. It is so easy. The first time I used it, I know when I heard it was coming, I was like, not another program. But as I was using it, the first time I had to do a wound assessment with it, our wound care coordinator was out sick, and I was kind of pinch hitting. We had some assessments that needed to be done. I said, no problem, I can do this. And I'm calling her on the phone going, okay, I've got this machine, what do I do? Literally a 2-minute phone call, and I was off and using wound rounds and doing wound assessments with it. The program is easy enough. It just kind of takes you through step by step. You don't miss anything. You just check the boxes. It's a tap screen, very easy to use, user-friendly, and like I said, very quick to pick up.